Thank you. Good afternoon. I've got the post-lunch session, so we should try to make it a bit interactive. My name is Charles Nduka. I'm the founder and chief scientist at Emteq Labs. I've been a plastic reconstructive surgeon for over 20 years, and my main goal around this area is to try to help patients with their facial expressions. Restoring smiles is difficult and complicated. One of the big difficulties is that between appointments, I have no idea what's happening to patients. Are they doing their expressions as they're supposed to? Are they practicing their expressions? How are they feeling? This fundamental question, how do you feel, is at the core of everything we do as clinicians, as researchers, and people developing new technologies. Now, we've moved a little bit away from this, but not much further. We're still asking patients via questionnaires or in-app surveys about their feelings, their emotions, what they've done. And we know that it's subjective, it's highly biased, there's often recall due to memory issues, and also context, such as recent events, can affect the responses. Why is this important? Well, the two leading causes of premature death at the root is poor diet and poor mental health. But we can't improve what we can't measure. We don't have tools to measure those things objectively in the real world and with patients in charge of their data. So if we look at the current model of care, over time, we do assessments in the clinic or ask patients to do surveys at home, and we're getting information at time 1 point, and these could be the same, but there's a huge amount of data between appointments that we are totally blind about. And this is the issue. We have no idea what's going on. Huge variability over time. So we have devices for measuring heart rate, blood pressure's coming, glucose monitoring, even temperature, which given insights around things such as disease prevention, prediction, ovulation cycles, a whole range of things. But we still lack that critical piece of information that underpins so much of premature death and suffering. Now, our faces reveal tremendous insights about how we're feeling, our cognition, our mood, sentiment, our focus, concentration, confusion, and also communication. We've known for many, many years that you can measure this objectively with a technology called facial EMG, that stands for electromyography, with electrodes stuck to the face. But this isn't practical for daily life. It requires adhesion to the skin, it's uncomfortable, it looks strange, and people won't accept it. But it's highly validated in clinical research settings. And for the last 10 years, we've been working on developing a non-contact, low-power way of doing this. And this is facial ophthalmography. This is a highly innovative way of sensitively measuring facial muscle activations. Tiny movements move the skin, and skin is captured with a sensor that mimics the action of an insect's eye. The kinds of insights it enables includes mood over time, allows us to measure dietary behaviors, eating rate, give people feedback, and more. So our technology is built on a platform based on the sensor with firmware and algorithms on device, transmitting data to a cloud-based platform for interpretation and analysis, and enables subsequent coaching and feedback. So this is the first platform that enables real-world monitoring of behavioral data through smart glasses. As a company, we've raised about $7 million in investments and also about $4 million in competitive grants and awards. We have 38 patents, of which 32 of them are granted, and we have 28 peer-reviewed publications. So why now? Why is this the time for this kind of technology? Well, I'm sure many of you in this room use or have used fitness devices. The time is now. Almost 500 million people bought these devices in 2024, and many people use them every single day. And why smart glasses? Well, many of you will have seen that glasses such as the Meta Ray-Bans are rising in attractiveness, looking normal, unlike the Google Glass of the past. 2 million pairs have sold last year, and 10 million are slated for next year. So this is a huge opportunity to take an important metric, like your blood glucose, like your steps, put it into the consumer's hands, but also to empower research. Obviously, this technology has broad applications across well-being, across medical, across sentiment analysis, and AR and VR. But we're starting small because we need the glasses to look as normal as possible. In fact, I'm wearing a pair just now. And this enables us to do dietary monitoring. Virtually every aspect of health is affected by your diet. Studies show that improving your diet can add 10 years onto your life with nothing else changing, which is extraordinary. It has impacts on things such as Alzheimer's disease. It affects diabetes. 90% of cases can be improved with diet. And everyone knows that improve your diet, do more exercise is an important thing. But people find it very difficult to measure this. Logging foods is tedious and boring, and our technology makes it seamless. It automatically recognizes that you're eating, captures the image of your food, analyzes its constituents, calories, and macros, and enables you to get actionable feedback. For dietitians, they've told us it's game-changing. It enables them to have superpowers to understand how their clients are doing and to give them proper feedback rather than basing it on biased, subjective data. So it becomes almost like an AI co-pilot for dietitians. We've also shown in our lab and also in a real-world study that we can change eating behaviors. People can slow down the eating rate, which has been known for many years can reduce their weight because you can reduce the amount of calories they consume per unit time. We can measure a wide range of metrics from this, which allows us to empower people much the same way we've seen with other wearables. So this technology is unique. Nothing else can do this across all areas of the 4 pillars of health in terms of diet, exercise, mood, and nutrition. And it's a big market. Huge opportunities across a range of different fields, from obviously bariatric surgery, the GLP-1s, patients coming off these, put their weight back on again. This can help. We've got solid traction across the 3 main tiers, working in partnership with universities, some leading academic universities, also working with some key partners in pharma, but also in sentiment to help to access novel data sources. Our team is led by Steve Strand, ex-head of hardware at Snapchat. He's launched previous smart glasses. Christian Gajewski is our lead data scientist and CTO, one of the top 2% in the world in wearable AI. Our first investor and advisor is Lord Darzi, who many of you will know as previous health minister. This technology has a wide range of uses, and I'm here to offer interaction with our company. If you're in any areas related to expressions, emotions, such as these, please get in touch. Thank you for your attention.
Thank you so much. What an interesting presentation. Just a quick question on the usability. Do you think, do you envisage these glasses being worn all the time or just while eating? And do you think that they can also incorporate things like the ability to hear better? How do you envisage them being used? Thank you.
Thank you. So the technology, to us, it really needs to be as normal looking as possible and to seamlessly integrate into a patient's life. But clearly, if you wear glasses already, then it's an easy one. It's no-brainer. I wear glasses already, and so wearing these glasses that are monitoring my dietary behaviors is super simple. What we found in our user groups and surveys and talking to trial participants is that depending on their pain point, their problem, they're very happy to, much as you see patients in clinic. You know, if you ask the patients to do something, if their problem is big enough, they're happy to do it. For consumer uses, I think it's super important that the glasses are comfortable, lightweight, and offer different styles, because obviously people don't want to be called out as being different. In terms of other capabilities, we're hyper-focused just now on dietary behaviors. The next phase beyond that will be around mood and passive mood monitoring. Again, almost like a Fitbit for feelings, rather than trying to focus too broadly. But then obviously other capabilities will be able to be rolled in. Our key role is to try and enable the technology to go into other people's technologies. So we've seen that obviously Google, Meta, Apple, these large companies are going to be offering smart glasses in the future. And our technology will almost be like Intel inside through partnerships. And that's worked very well for other companies, and we feel that it could help in this case.
Hi, thank you. Really interesting. Clearly, exciting technology. I've seen like loads of possible use cases. It would be great to understand, you know, where are your next steps? Where's the path to revenue? Where are you focusing? Like, what happens next to generate revenue?
So our North Star is health, in terms of behavioral health, mood monitoring. But clearly there are some low-hanging fruit that doesn't require us to have very slimline form factors. And so we have an LOI from a sentiment company, for example, who do screenings in a room such as this with a couple of hundred people. We have it's a 5 million term sheet that's just currently been finished off to use the glasses for passive monitoring, because currently you spend $200 million on a film and then you ask people to fill out survey questions to find out whether it's going to be successful or not. So giving people the ability to map content better to their target audience is one of the use cases for early revenue. The next phase of work for us in terms of the health uses is via working with universities and also pharma to use this technology for assessing, for example, Parkinson's disease. We've done some work on that, and also depression. So we've got a peer-reviewed publication showing that we can distinguish between depressed versus non-depressed people with actually even only a short amount of data, and that's published in Frontiers of Psychiatry by Professor James Stone.
Just one question for you. So we talked a little bit about, obviously, various big tech players. So Google kind of famously came out first and failed. Meta's now the current one, and everyone's waiting for Apple. You mentioned it's got 28 patents so far. What sets the sensors apart from the obvious big incumbent players?
So companies like, Apple Vision Pro, for example, came out and it does facial avatars. And how it does that is by having lots of tiny cameras inside, which image a small part of the face, and they use deep learning and a specialized chip to reconstruct that into a face. Same with Facebook's previous, or Meta's previous version of it. That's incredibly power intensive, trying to take an image and then translate that. What we're doing with ophthalmography is converting the movement of the skin into a vector, which means it's a tiny amount of data. And then use that vector, knowing where the muscle is in relation to the sensor, to reconstruct the expression. So, I mean, we have a demo outside if you want to see it, but that enables us to be the holy grail. These devices currently are very bulky, they're very heavy, and we can cut the power consumption by orders of magnitude. Thank you.